Hi, my name is Dr. Michelle Cutler. I've been teaching at the Chicago School in the Clinical PsyD department for 12 years. One of my favorite classes to teach, and the thing I have a particular passion for, is the Child Trauma course, which I developed about 10 years ago. In collaboration with the National Child Traumatic Stress Network. And the reason why I love teaching this class so much is I use a method called problem-based learning, where instead of teaching students the concepts through a lecture, we are taken through a series of case vignettes. So we use the entire class period to go through a clinical example of a child and family exposed to trauma, how we would do the assessment, what types of questions we would ask, and then taking them through various stages of treatment. And I love teaching it this way rather than me just imparting knowledge based on my expertise and experiences. Students are able to teach themselves and work together to help these children and families in the vignettes and learn through that method. And then, of course, we follow up those classes with a lecture and class discussion about the things that they've learned. I'm part-time at the Chicago School, and I really enjoy this flexibility. In addition to teaching at the Chicago School, I have a group practice, a small group practice in the city of Chicago, where we work with kids and adolescents and adults as well. My own clinical practice, I see mostly children and a lot of children and young adults exposed to trauma. Also at my practice, we have a supplemental practicum experience where we are given cases from the Chicago Children's Advocacy Center. These are kids and families that have experienced child sexual abuse, and then students provide the treatment and we provide the supervision. We also provide parent-child interaction therapy at our group practice, which is another really fun thing to talk about with students. I really love the opportunity that the Chicago School gives me to be able to have my group practice and to teach. I find that working with students and teaching courses makes me a better clinician. And then my clinical experiences help me to be a better professor as I'm able to share these experiences and use them in my classes with students.